Hello and welcome to Health Beat. My name is Kimberley Pietz. We're at the emergency room of Parkland Medical Center. The Greater Derry Public Health Network has partnered with Parkland to sponsor this series of programs that's meant to inform you and your family about some health issues. Our first in the series will be on cold and storm safety. We want to make sure that we have everybody out there nice and dry and warm, and that no medical emergencies do arise. Of course, if something does happen, we have a great resource here at Parkland. I'm joined by Dr. Scott. Dr. Thomas Scott is the emergency director here at Parkland. How are you today?
I'm good, thank you.
And how long have you been with the emergency department here at Parkland?
I've been here at Parkland for 8 years.
Okay. And what's your official title here?
My official title is Medical Director of the Emergency Department.
Now, the focus of our program today is going to be storm and cold weather safety. What are the most common types of things that you see?
The most common things that we see after and during a storm are related to injuries from removal of the snow, including people getting caught by the snowblower that they're using. Also from shoveling heavy snow, we get back-related injuries. And then we also get chest pain-related injuries from the heavy exertion that these people use during snow removal.
So the most common types of injuries are actually related to the removal of the snow. What are some things that people can do to prevent snow removal sorts of injuries?
There are several things people can do. The first thing is, if they are not in physical shape to remove the snow, is to hire someone to remove the snow for them. Hire a professional to come and take care of that for them. This way they don't actually find themselves in a position to sustain an injury. The second thing is to make sure that if they are going out to do it, that they understand the equipment that they are using, because most people are unaware that snow blowers, even if they stop, actually have a second turn left in the blade. So most people are aware you're supposed to use a stick to clear the snow out of the blade, but some people do accidentally get their hand caught in there, and it has one more turn, and it actually can cut them or injure them quite severely.
Now, can something like that actually take off a finger? Or?
It can take off a finger, it can take off a hand, it can do a lot of damage to a person. It can actually throw ice or whatever that's in the chute out at them at a great force as well, injuring them in the face or chest.
Absolutely. So it's important to understand the equipment that you're using if you are using machines to help clear your driveway and other areas. Now, how about snow shoveling?
Snow shoveling is a very difficult process for most people, especially when we're having the weather that we've been having this year, simply because the snow is very heavy and most people don't use the back mechanics that they should to lift the snow. They tend to use their arms and just bend over and lift, as opposed to actually bending down with their knees and lifting it up with their shovel. The other thing most people don't do that they should do would be to take breaks in the middle. Most people want to go out and get it done in one shot, so they go out and overexert themselves and maybe actually injure their back doing that, simply because they should have taken a break somewhere in the middle.
Is it something that you recommend to people to go out after a couple of inches have fallen?
Oh, absolutely.
Again and
this
again?
way you're not removing 2 feet of snow, you're removing 8 inches at a time, and this way you give yourself a chance to actually be able to move some of it rather than trying to lift heavy mounds of snow.
Now, what if somebody has a heart condition? I understand that if you have a heart condition, that the worst time of day to overexert yourself is the morning, when people are probably getting out for their morning commute. What do you recommend for people who might have other issues going on before they get out on those roads?
To drive, you mean? Is that
well, no, to shovel, to clear out their cars, to get ready for their morning commute.
I mean, one of the things that I don't think people realize is the amount of energy that is exerted during snow removal. A lot of statistics are available in the United States that say there are several points of time that we know that people actually have heart issues. They revolve around the holidays, they revolve around major snowstorms, because people go out and, again, believe that they have the energy that they had when they were 20, and they go out and they try and exert themselves more than they have the rest of the year, basically in one episode. And in the morning, your hormone levels are certainly at a different level than they are during the rest of the day, thus increasing your chance of actually having a cardiac issue during that event.
Do you ever see people who have cardiac issues after going out in the morning to shovel out their cars?
Absolutely. We see it almost after every storm. We have someone or several people who come in having some type of cardiac issue from being out and clearing the snow.
So again, when shoveling the snow on your property, it's really important to make sure you're taking the necessary precautions and reminding yourself too that there's a lot of snow, it's a lot of physical exertion.
That's correct.
When we are removing, especially the mountains of snow we've been having
That's
this
correct.
year. Now, how about some other cold weather issues and storm-related issues? What other things do you see here?
Some of the other things that we've been seeing over the last couple of years has been during the power outages, when people lose power and they run into medical emergencies that they would typically be able to handle by themselves at home, but because of the lack of power, they run into issues, whether it's a breathing problem where they would typically use a machine that they can no longer use because they don't have the power to run it, or what they do is they will hook up a small extension cord to a generator and actually use their machine near the generator, which in that case they're actually getting fumes from the generator on top of their medicine from the machine.
Right, so these are primarily breathing devices, right, Dr.
That's correct.
Scott?
That's correct.
Okay, so what do you recommend for people in the winter time as far as preparing themselves for potential emergencies? Because of course these things require preparation prior to the actual event. Should they have some sort of backup unit?
One of the things they can do is actually just be aware of the hazards around using a generator, which would be carbon monoxide, the fumes from the generator itself, the fact that it may not supply all of the electricity that they would need to run certain machines at home, whether they use a machine at night to help them sleep, which would be a CPAP machine, whether they use a nebulizer several times a day. One of the other issues we ran into during the large ice storm several years ago was people who had diabetic problems who kept insulin in their house began to have their insulin freeze because they were not storing it properly. And what they were running into was diabetic problems. So one of the things people need to consider is having a generator that is hooked to their house by a professional, by an electrician, so that it is hooked up properly. The second thing to do would be to make sure that when we know that these storms are coming, is to make sure that they have a good supply of their own medicine on hand should an emergency arise in their house and they are unable to get out or seek actual medical attention. And then the other option would be is if you're having a medical problem, to certainly seek professional medical assistance immediately and not try and wait it out at home where you can find yourself in a large problem.
Absolutely, and you mentioned a very important thing as far as storage of medicine. It's important for people to know how to store their medicine properly, not only during normal routine types of days, but also too during an emergency. What do you recommend for people that use insulin if they should lose power in their house? What's something that they can do?
One of the things I think prior to the storms, they would need to talk to the pharmacist to learn exactly what are the limits of the storage of their medicine, whether it can handle certain temperatures, what temperature can it go down to, what temperature do I need to leave it at. The other thing that they would need to consider would be having a storage place that might be insulated if they're unable to use the refrigerator during these periods, to make sure that their medicines stay at a constant temperature so that they're not fluctuating.
And they should probably get one of those small thermometers like you would keep in your refrigerator that they can move to different places.
Absolutely.
They should have to change where
Absolutely.
their medicine is. Okay, another important thing that you mentioned for us is carbon monoxide poisoning, that's something that is always an issue. And I just wanted to cover what carbon monoxide poisoning is and how people can get it.
Carbon monoxide is a odorless, colorless gas that is given off by petroleum products, whether it's a generator or a gas stove. It's usually given off by the burning and combustion of it. And what it does is it actually is bound to our blood stronger than oxygen. And what it will actually do is it will slowly suffocate you. And most people are unaware that it's happening because you cannot smell it, you cannot see it. And what begins to happen is you develop this headache, some nausea, some vomiting, what most people actually would contribute to a stomach bug or a flu symptom. But the difference between those is when you go out from the environment of the CO gas, the carbon monoxide gas, you actually get better. So it actually typically happens in a certain area, whether it's your bedroom or near your garage or in your kitchen or near your gas stove or whatever it is, where the carbon monoxide is highly concentrated, you will actually begin to feel ill.
Right, so is it something that you instantly feel better? Like if you step out of the house and get into the fresh air, you're instantly going to feel a lot better?
You will instantly know that you're getting better, yes. I mean, it takes a few minutes for it to really work its way out of your system depending on the concentration within you. But if you've had a minor exposure and you go outside, you will certainly know that you feel a lot better. You will realize that you are clearing up. And that's actually how most people realize they've been exposed, is they step outside and they begin to feel better.
Right, for some reason they just go outside and
Correct.
all of a sudden they're like, wow, that's a big difference. You mentioned generators as being a primary way of people developing carbon monoxide poisoning. What are some other ways that you can develop carbon monoxide poisoning?
Several of the ones that we saw during the ice storm were people using their barbecue grill in their garage, people bringing it into their house because it was too cold outside, so they would bring the grill in because it was the only way they could cook.
Okay.
People using their gas stoves to heat their house because they had no other way to heat their house, so they would open their oven and have the gas on that way trying to heat their house, and what they're really doing is exposing themselves to carbon monoxide. And the other way would be to not have your chimney cleaned properly each year, so that as it builds up and you begin to actually use it as a primary way of heat, you actually start to build up the gas inside your house. And then when we have a large ice storm or snowstorm, the snow or ice can actually block what would be a normal vent that is being used to get this stuff out of your house.
Okay, so if you're using a barbecue in order to cook your food during an emergency, make sure you're using it properly outside.
Correct.
If you're using a stove to heat your house, that's probably not a good idea.
It should not be used at all to heat your house.
Right, and if for some reason you do feel the need to use your stove to heat your house because maybe of lack of energy, there's all sorts of programs out there that people can reach out to if they don't have the money for proper heating. It's very important to not heat your house with your stove. And like you said, make sure you have your chimneys cleaned, if you have chimneys, and clean out the vents around your house. Maybe it's a good idea to take a visual inspection.
Absolutely. Before the storm arrives, to know what vents are out there, what vents have potential to be clogged, and knowing what each vent does, because some vents may just be doing, through your bathroom or whatever, and really actually move the gas out, and most people don't consider those as gas vents.
Absolutely, and you don't think of it.
Correct.
Necessarily. That's a really great point. Now, another issue that we wanted to cover today is the topic of frostbite and hypothermia. Of course, with the winter time and all of the abundance of the snow we've had, many people are interested in getting outside and doing some skiing, maybe some snowshoeing, and of course ice fishing and fun activities like that once the lakes are clear for such activities. Now, Dr. Scott, what do you recommend for people as far as avoiding frostbite and hypothermia?
The biggest issues to avoiding them is to know the weather you're going out in. In the next several days, our temperature is going to drop below zero. And most people probably have about a 15 to 20 minute tolerance in being out in there. And exposed skin probably has about a 10-minute tolerance before frostbite will begin to set in. I know people will be going out in that weather, and the thing that they really need to do is dress in layers, dress warm, be prepared for the cold. If they are doing an outdoor activity like ice fishing, to make sure that they actually are prepared should the ice give way and they land in the water, which would be A, know how to get out of the water, make sure that someone is aware of where you are so that you have a way to have someone help you. And then the other thing that I typically recommend to people out on those kind of things is to have a change of clothes with them. So should they go in the water, the best thing to do once you get clear of the hazard is to get out of the wet clothes you are in and into whatever dry clothes you can get to. Because having the wet clothes attached to your body, certainly our water up here is probably 35 degrees. You probably have a 5-minute to 10-minute exposure on that before both frostbite and hypothermia will set in if you are soaked in the water.
Now, what causes frostbite and hypothermia, and what are the differences between the two conditions?
Frostbite is when your skin and the fluid within the skin actually begins to crystallize and freeze. And what can end up happening, and typically it happens to the extremities, whether it's the fingers or the feet, when they get damp and wet, the skin within those extremities will actually begin to freeze. And you first start with what we call frost nip, which is where it begins to get cold and becomes cool, and what will end up happening is the extremities will actually become very pale. They will start to turn white. And at that point, the thing that you really need to do is get out of the environment as best you can. Certainly if you're trapped in it, that's one thing. But if you have the ability to get out of it, the first thing you need to do is get in and start to slowly warm those extremities with some gentle heat and maybe some lukewarm water to just start returning the circulation back. If you do develop frostbite where the actual extremity or digit freezes, what you really need to do is seek professional medical help at that point, because what could end up happening is it can extend up into the extremity farther that you can actually see, and you could end up with actual loss of the entire extremity due to both frostbite followed by severe infection of that extremity.
Absolutely. So you might just feel it in your fingers or your toes, but it can move its way up.
Correct. Correct.
Okay. So
And what will end up happening is most people will feel the frost nip because it's cold and it begins to burn. But once frostbite sets in, because it is similar to burns, like deep burns, the nerve endings are actually frozen and you actually stop feeling it. So you don't even know it hurts anymore.
Absolutely. And then what's the difference between that and hypothermia?
Hypothermia is where the actual core organs of your body begin to cool. Your heart, your kidneys, your intestines, your brain, your lungs actually begin to drop below what we consider a survivable temperature for your body. Typically, most people, when they get down to about 95 degrees, with normal body temperature being 98.5, will begin to actually have a chill and start to shiver. And when your body starts to drop below that, certain organs will begin to remove blood from them and send it to the center to keep it warm. So your legs will actually start to lose blood to save the heart and lungs and kidneys and brain. And as those begin to cool and you start dropping down to about 90, your heart can actually start developing what we call arrhythmias, where your heart starts actually acting funny and can actually cause you to have a cardiac arrest.
Now, what are some of the ways that you can get hypothermia, and what should you do when you feel like, okay, this might be a situation where this is the real thing? How do they make the decision? How do people make the decision to seek medical help?
The first thing that we always tell people about seeking medical help would be, if you think you have an emergency, seek medical help. Do not sit home trying to decide whether or not this is an emergency, because it's very difficult for lay people to understand the difference between a minor emergency and a major emergency. And we in the emergency department would prefer to be the ones to tell you that this was not an emergency versus, that this was a terrible thing and we should have seen you several hours or days ago. What most people ought to do, A, is to, again, dress in layers to prevent it, for one thing. I mean, that's the most important thing. But should they begin to have a hypothermic event, I mean, typically what they will have is they will know they are cold. They will be shivering. They will feel the cold. Up here, most people that we see have typically been exposed suddenly to the environment to develop the hypothermia, whether it's they fell into the lake, or they were out in the woods hunting or ice fishing, and they were overexposed either because they got lost or because they ended up trapped for whatever reasons, whether their machines broke or whatever it was that prevented them. But typically most people will know simply by the shivering and the cold. And what will then begin to happen is they will then begin to have some brain malfunction. They will begin to not think properly. People around them will be trying to reason with them, and they won't be acting appropriately.
Okay.
They will be saying things that I'm okay, and you're thinking, no, you're not okay. You're actually very sick. And then what will begin to happen is they will actually begin to lose consciousness. They will begin to lose their fine motor coordination. They won't be able to do the simple things of turning a car on. They won't be able to turn their hand enough. And that's when people get in trouble, because then it's similar to a deep diving accident, is people lose reason. They don't realize that they're in trouble.
Absolutely. And so something that's really important that you mentioned before, when you're engaging in these outdoor activities, make sure that you have a nice warm pair of clothes, different pants, some different shirts that you can change into if something should happen. How about for the average person that's just going back and forth to work, just picking the kids up from school and different activities? What should we pack in our cars during the winter weather, so if something should happen and we slide off the road and have to wait for, you know, a rescue vehicle or AAA, what should we have in the car available for ourselves and our children so nobody has to suffer something like frostbite or hypothermia?
I think the biggest thing that people need to know is that our weather changes quite quickly, and typically what people should have in there is their winter clothes that they would wear if they were going outside to play in the snow. A jacket, boots, hat, gloves, maybe a scarf. The other things that you want to keep in your car would be a shovel, so that you can actually shovel some of the snow away from your vehicle should you slide off. And you might be able to get it out before a tow truck arrives if you could just move the snow away from your vehicle. The other thing the shovel would help you do is if you do slide off and it's going to be some time till help arrives, it will also help you shovel snow away from your exhaust system so that carbon monoxide does not build up in the vehicle while you're sitting trying to keep yourself warm, just waiting for someone to come and help you. The other thing people ought to keep in their car would be a car charger for their phone, so that should they find themselves in trouble, they have an ability to actually phone somebody, because most people don't think about it. You know, I'm just running to the store, their cell phone dies, now they're on the side of the road and help isn't coming for a while and they have no way to call anyone.
Absolutely. How about things like water? Is it important that we keep water and stuff like that in the car, even in the wintertime, for hydration purposes?
It is important. The other thing you have to keep in mind, though, depending on where you store your vehicle, is the water may simply freeze in your vehicle. So what you think is helping you turns out to be a solid block of ice when you actually go to need it. So you have to kind of keep that kind of preparation per trip, I would think. You know, I usually keep one small water in my car just because, but typically if I work a night shift, I come out, it's frozen solid by the time I walk out the door.
Absolutely. Well, thank you very much for your time today, Dr. Scott. We really appreciate it. And of course, we appreciate you watching this series. We look forward to providing you with more information. I hope you've enjoyed this information that we've gone over today on snow and cold weather safety. Once again, my name is Kimberley Pietz. Thank you for watching Health Beat.